This is what we are covering for you. There's a lot of red spots there. What you see is actually how it has affected several places. And the government is saying brace for even tougher times. You see this number here, 10,000. That is the projection by the end of April if all factors are held constant. So brace yourself for the worst. The Ministry of Health is tonight really sounding a warning that we could see a projection of more than 10,000 COVID-19 cases by the end of April. This has 8 more people tested positive for the virus, bringing the national total tally to 50 cases. And as Chemutai Goin now reports, as the government intensifies its mitigation reports, boda riders will onwards be required to carry only one passenger per trip, with a requirement that both the rider and the passenger wear masks.
That COVID-19 is a deadly disease is no longer a myth, having crippled even the most developed nations. In the last 24 hours, Kenya's positive cases, as announced by Health Cabinet Secretary Chemutai Goin, rose to 50. This week, more cases expected as those who had been placed in mandatory quarantine undergo mass testing. According to health officials, this is done on the 8th day depending on when the individual was placed on quarantine. Results of 14 more suspected cases expected Tuesday.
The 8 cases are now spread out in various counties in the country. Kitui now has 1 case. Nairobi County has 6 new cases, while Mombasa 1.
Nairobi, however, remains the epicenter with a total 37 cases, Kilifi at 6, Mombasa 4, while Kajiado, Kwale and Kitui have 1 each. Out of the 43 positive cases, 26 are male, while 18 are female.
Tracing of contacts for the 50 confirmed cases is ongoing.
But what should worry Kenyans is the revelation that by April, the number of infections may rise to 10,000 if precautionary measures are not adhered to.
Our modeling puts us at having about 1,000 cases by the first week of April, and we postulate that we'll have 5,000 cases by mid-April.
From the above data, it is evident that the virus is now being spread through community transmission. Community transmission means that the disease is no longer imported from the outside, but is here with us. We are now spreading it among ourselves.
To contain the spread and avert a possible crisis, bodas, one of the most preferred means of transport by Kenyans countrywide, will be required to make a few changes. Only 1 passenger will be allowed aboard, and both the rider and the pillion must wear masks. Police directed to oversee the implementation of the directive.
We shall be spreading out masks in the counties for this purpose, but irrespective, the boda rider and the passenger must both wear masks.
Even as employers were directed to release their employees by 4 p.m. to ensure they meet the 7 p.m. curfew imposed, Kenyans residing in urban areas were advised against traveling up country to minimize the spread of the virus, especially to elderly Kenyans.
Statistics have shown that majority of our elderly people live up country and that they are likely to get exposed, as it happened in Italy, by this kind of movement.
One thing that could work to our advantage is the fact that our population is more youthful. So potentially it is possible that our people will be able to catch the virus, but probably just pass on as a mild illness. What may work against us, of course, is our weak health system and, of course, our disease burden, especially HIV.
Already the government has put in place other interventions in case the numbers rise further. Deputy President William Ruto revealing that counties have been directed to identify 20 boarding schools each that will be used as treatment and isolation centers.
There is nothing that is not on the table. We have seen what other countries are doing. We have seen field hospitals, we have seen people working in stadiums, and so on.
More medical personnel are set to be recruited this week to boost the numbers following fears that the sector would be overwhelmed even as tracing of more close contacts intensify. With questions raised over the country's state of preparedness, if the projections by the Health Ministry are anything to go by, then if that is met, it is a sure recipe for chaos. Attention now being on Kenyans and on the government to contain the spread of the virus. Chemutai Goin, Citizen TV, Nairobi.